Hello, this is Dr. Theresa Rohr-Kirchgraber, coming to you from the Eskenazi Women's Center of Excellence. We're going to be talking today a little bit about why you need to talk to your family over the holidays. The holidays are a perfect time, sitting around at Thanksgiving or even Christmas. The idea is that we really need to know your family history. You need to understand what kinds of diseases or problems members of your family have had, because when they're related genetically, there could be some things that we would need to do differently for you. So let's talk about those. One thing, for example, is if you have a family member that has had some significant heart disease, especially prior to the age of 60, that may change what I need to do for you when I see you in the primary care office. Also, if you have a family member with diabetes, that does mean that you're at increased risk. So there are certain things that you need to be able to sit down and talk and find out about. Another thing that comes up so much is cancer. Many times patients will tell me that they have a strong history of cancer in their family, but I need to know what type of cancer, I need to know what age it developed at, and how closely related they are to you. So let me give you an example. A family member of ours recently had always thought that his grandfather had died from lung cancer. He knew as a child that his grandfather had died of cancer, and he knew that he was a smoker, and he just made that relationship. Recently, he found out that actually, in speaking with his mother, his grandfather had actually died of colon cancer. And he said, "Wait, why didn't you tell me that before?" She goes, "I don't know, I just assumed everybody knew that." And she, his mother, had colonoscopies and had colonic polyps. Well, colonic polyps are a risk factor for colon cancer, and so that would mean that he, this family member, should have been screened perhaps a little bit earlier. So knowing the types of cancers when they developed could really make a difference in what your primary care physician will need to do for your own health. We have another great example of that, of a younger woman who is in her mid-30s, who on her family history, we found out that both her father and her grandfather had died very early of colon cancer, and it turns out that when she got her testing done, she did have a condition called familial adenosis polyposis, which basically a whole lot of polyps in her colon that could lead to colon cancer. So it was very important to find that out early. The other types of cancers that you want to be concerned with are skin cancers, especially things like melanoma, any kind of gynecological cancer, so especially things like ovarian or endometrial cancer, those would be very helpful to know. Breast cancer also is extraordinarily important, especially if it's in a first-degree relative like a mother or a sister. For men, you worry more about prostate cancers, so please keep that in mind. There are other things that we should take into consideration as well that may change the way that we screen you. For example, we mentioned diabetes. High blood pressure is another one that you should know about, and any kind of blood abnormalities in your family members. For example, anybody with sickle cell disease or sickle cell trait, any types of thalassemias, because that changes what you see on blood work. Also, any kind of clotting disorders. If there's a family member that's had a blood clot, whether that blood clot went to their brain or their heart or their lungs, it would be important for us to know that, because that would change the type of medications that we could give you. And probably one of the last things to be thinking about is any major psychiatric disorders, especially things like schizophrenia, major depression, suicidality. That does put you at increased risk, and we want to know about that. I appreciate that you're going to take the time this week or this month when you're at Thanksgiving and when you're at Christmas to talk to your family and get some very detailed information from your relatives about the types of conditions and medical problems that they've had, and then bring that back to your primary care physician and incorporate that into your family history so that we know how to screen for things properly for you. And if you don't know, that's the way it is sometimes. Sometimes family members never really shared, but we'll still do the best that we can in screening you appropriately for conditions that can change your life. This is Dr. Theresa Rohr-Kirchgraber. Thank you.